except for we're going into it a little bit deeper. Okay, we're taking our baby steps. Okay. And I sent y'all the workbook for chapter 5. Okay. This I'm not interested in. Okay. From anatomy and physiology. When you took it in college, you have 5 sacrums. Is it 5 for coccyx? Yeah, 5 sacrum, 4 coccyx. Okay. Okay, these are the muscles that you need to know pertaining to the pelvis. You've got the false pelvis and you have the true pelvis. Your true pelvis, you have in the lower pelvis, you have the rectus abdominis, which is the anterior wall of the muscles. You've got the psoas major, which is the posterior wall of your abdominals. Your false pelvis, you have your iliacus and you have your iliac fossa. In your true pelvis, you have your obturator internus, which is the lateral wall. You have the piriformis, which is the posterior wall. It's the piriformis muscle that is the most common muscle confused for an ovary. The piriformis. You have your coccygeus, which is the posterior floor. And you have your levator ani. Your levator ani is also called the diaphragm or the pelvic floor. It is made up of 3 muscles: pubococcygeus, puborectalis, and iliococcygeus. Basically, it is just a band of muscle that go from the symphysis pubis to the coccyx. It's a series of 3 muscles that make up the levator ani muscles. Here's just a picture of the ovary, and this arrow right here is the iliac muscles. Here is your ovary. What phase is my ovary in here? Follicular phase. What you see here is going to be an iliac vessel. You have iliac arteries and you have iliac veins. If you cannot find the ovaries, go lateral to those iliac vessels, and a lot of times they're laying next to it. Here is the bladder. Here is the uterus. Here is an ovary. This is a transverse, trans-abdominal view. Iliopsoas arrows. The iliopsoas muscle is the arrow. The bright open arrow is the femoral nerve. So this is how the muscles are going to be in there. See the coccygeus? The coccygeus is part of your pelvic floor also. Here's a good picture of your pelvic floor, also called the pelvic diaphragm, okay? Here are a list of the 3 muscles that make up the levator ani. Your piriformis is the muscle that is most confused for an ovary. It is on the registry. You've got a true pelvis and you've got a false pelvis. They are divided by an imaginary line. That imaginary line has 3 names. The iliopectineal line, the pelvic brim, or the linea terminalis. All 3 of those are what we talk when we talk about the true pelvis and the false pelvis. Here's a picture of what they were talking about. Here's my coccyx, here's my sacrum, here's my 5th lumbar. Here is my false pelvis, also called my major pelvis. It's mostly bone, the ilium and ischium. And then down here is my true pelvis, or the minor pelvis. That's where all my female organs are. Iliopectineal line is here. Iliopectineal line is also known as what? Linea terminalis, or the pelvic brim. Okay, so let's talk a little bit about the female external genitalia. The mons pubis is where our hair is, and then we have the clitoris that is anterior. Okay, we have 2 different lips. We have the labia majora that has hair on it, and inside that we have the labia minora. Then you have the opening to the vagina, which is called a vestibule. Here's my anus. This area right here is called my perineum. If my baby is too large to come out, then they cut the opening, a 1, a 2, a 3, a 4, a 5. Okay, sometimes they will cut it the whole way.
Wow.
Okay, very painful. Okay, so now we're going to talk about the pelvic recesses. The pelvic recesses. We're going to go anterior, because this is anterior, to posterior. Here's my sacrum and coccyx, and here's my rectum. Okay? Right underneath my symphysis pubis, I have the space of Ritzis. It's also called retropubic or pre-vesical. Okay? Pre-vesical. Now, that was anterior bladder. Now we're going to go posterior bladder. Posterior bladder, between the bladder and the uterus, I have my anterior cul-de-sac, also called vesico-uterine. Now, I'm on the other side of my uterus. I'm between the uterus and the rectum now. It's called the posterior cul-de-sac, also called the recto-uterine. also called the pouch of Douglas. Here's just a picture of it. Anterior to the bladder, the space of Recesses, retropubic, because it's right behind the pubic bone, the symphysis pubis, and prevesical, in front of or anterior to the bladder, and the bladder is just a vessel. On the other side, posterior bladder, I have the anterior cul-de-sac, also called the vesico-uterine, meaning between the bladder, which is a vessel, and the uterus. Okay? Now I'm on the back side of the uterus. The back side of the uterus is the posterior cul-de-sac, also called the pouch of Douglas, also called the recto-uterine space. These are all the spaces when we do a pelvic sonogram that we look for free fluid. Okay, so here is a bladder. You have the serosa. You have the inner layer of it's a muscle that causes the bladder to contract when we have to go to the bathroom. Here are where the ureters go into the bladder, posterior, inferior bladder, at the trigon. The trigon is the area of the bladder where the urethra will exit. The bladder. The bladder is located posterior to the pubic bone. It's anterior to the vagina, and its superior surface is related to the uterus. That's why we need the bladder to be full so we can look at the uterus fundus, is to bring that down. Here is an anteverted uterus. Empty bladder, full bladder. Here is an anteverted uterus. Here is a ureteral jet. This is important for us, is if we're looking for a kidney. If we can't find a kidney, we're gonna go to a transverse bladder and we're gonna document a jet. Okay, because if I see a jet on both sides, then I have both kidneys. Okay, because I have a left kidney and a right kidney, I should have a left jet and a right jet.
So we have to wait for the jet.
You sit there and watch it. Sit there and watch it. Okay. This is a uterus with a cystic structure in the right adnexa. Notice that I did not call it a corpus luteum because I didn't do the imaging. I haven't read down here. Okay? So I know it's in the right adnexa. But because of ultrasound and how it hits something round and it's a straight echo, then it causes a reverberation, a side lobe artifact. A side lobe artifact. This is important for us. You're not going to get until artifacts until I think next semester. But you have to know those artifacts that help us in imaging now, because we use artifacts to help us make a diagnosis. An anteverted uterus. See how full this is? The uterus is laid completely down. You can bet that whenever I push on this patient's belly, she's probably gonna be curling her toes. Okay, because she has to go to the bathroom so much. Not so much here. Now, here we have a little bit of free fluid. Okay? When we take this image, we're gonna turn transverse on it and make sure that it's not bladder, that it's free fluid in the anterior cul-de-sac. And we annotate that FF. Here is an anteverted uterus.